Hello, my name is Diana Reyes, and this is my physical examination assignment for NR 509.
I'm Edgar Reese, and I consent to the filming and submission of this video to Chamberlain College.
I'm going to do a 360 of the room. My name is Diana, and I'll be your nurse practitioner today. We'll go ahead and start off by inspecting the face. I don't note any abnormal lesions or any discoloration to his face. His head looks symmetrical and it's midline. I'm gonna go ahead and start palpating your lymph nodes. You let me know if you have any tenderness along the way. Pre-auricular lymph node in front of the ear. Post-auricular lymph node behind the ear. Occipital lymph node in the back of the head. Tonsillar. Submandibular lymph node down the jawline. And then submental lymph node underneath the chin. Within the neck, we have the anterior cervical lymph nodes, posterior cervical lymph nodes, and then the supraclavicular lymph node above the clavicles. Did you have any tenderness?
No.
So no tenderness, and I didn't feel any lymph nodes or any enlargements of the lymph nodes. Moving on to cranial nerve number 5. Cranial nerve number 5 is the trigeminal nerve. With this, I'll be testing sensory and motor components. With the motor component, I'm going to palpate over the masseter muscle. Go ahead and clench your jaw. So the strength there feels 5 out of 5 equal bilaterally. The jaw is pretty much intact. Do you have any tenderness?
No.
I don't feel any deformities or distortion with that. So the motor part of cranial nerve number 5 is intact. With the sensory component, I'm going to touch certain areas of your face with your eyes closed, and you're going to let me know what I'm touching. So go ahead and close your eyes.
Nose, chin, forehead, right cheek, left cheek.
Alrighty, so the sensory part of cranial nerve number 5 is intact. Moving on to cranial nerve number 7, which is the facial nerve. With that, I'm going to have them do certain facial expressions, and I'm looking for symmetry with this. So go ahead and smile real big for me. Frown. Raise up your eyebrows. Puff your cheeks out and pucker your lips. So all those look very symmetrical to me. So cranial nerve number 7 is intact. Alrighty, so moving on to his ears. I'm inspecting his ears. They look symmetrically. I don't know any obvious lesions or obvious drainage, no redness or swelling to them. With my otoscope, I'm going to go ahead and take a look into his auditory canal. I'm going to pull his pinna up and back so I can better visualize his auditory canal. Looking into his auditory canal, I don't see any redness or any swelling or obvious drainage. No cerumen impacting the canal there. I don't see any effusion to the middle ear either. His tympanic membrane looks pearly gray. Did you have any tenderness?
No.
Okay. Moving on to the next one. Pull the pinna up and back. Looking into the canal there. I don't see any redness, swelling, drainage to this side either. The tympanic membrane is pearly gray. No effusion to the middle ear. No cerumen impacting the ear either. Did you have any tenderness in there?
No.
Okay. I'm going to palpate your pinna and your tragus. Let me know if you have any tenderness. Palpating the pinna and the tragus. Any tenderness?
No.
So I didn't feel any nodules, and he doesn't have any tenderness with that. So everything looks pretty normal and intact with the ears. Doing cranial nerve number 8, I'm going to be doing the whisper test. I'm going to have you cover one ear. I'm going to whisper things into the other ear that you're not covering, and you're going to repeat after me. So go ahead and cover one.
1, 2, 3.
Okay, good. Cover the other ear.
4, 5, 6.
All right, good. So cranial nerve number 8 is intact. Moving on to his eyes. I'm going to inspect his eyes. Look up for me. So his conjunctiva is moist and pink. His sclera is clear and white. I don't know any obvious lesions or drainage there. With the eyes, I'm going to test cranial nerve number 2, which is the optic cranial nerve. I'm going to be testing his central vision, peripheral vision, and his pupillary response. With the central vision, I'm going to be using my pocket Snellen chart. I'm going to step 6 feet away. I'm going to have you cover one eye and read the lowest or the smallest line you can read.
LFTPH.
Go ahead and cover the other eye and read the lowest line.
LFTPH.
Now with both eyes, read the lowest line.
LFTPH.
So he has 20/20 vision in his right eye, 20/20 vision in his left eye, and 20/20 vision bilaterally. So with the peripheral vision, I'm going to have you stand up, look straight ahead. I'm going to wiggle my fingers and you let me know when you see them.
See them. See them. See them. See them.
All right, peripheral vision is intact. Go ahead and have a seat. I'm going to look into his pupils and check for his pupillary response. Look straight at me. I'm going to flash this light over your eyes. So pupils are equal, round, reactive to light, and the diameter of his pupils are 3 millimeters. So moving on to cranial nerves 3, 4, and 6. Cranial nerves 3 is oculomotor. Cranial nerve number 4 is trochlear. And cranial nerve number 6 is abducens. With all these 3 cranial nerves, we're going to be checking for the extraocular muscle movements of the eye. So I'm going to have you look at my finger and just follow it. I'm going to do an H. And you just go ahead and follow my finger. Perfect. So cranial nerve 3, 4, and 6 are all intact. Moving on to his nose. With the nose, I'm going to inspect the nose. It looks straight. I don't know any fractures, any deviation, or any obstructions. No obvious drainage, redness or swelling to it. I'm going to take a look into his nose. Go ahead and tilt your head up for me. And with my thumb, I'm going to push your nose, tilt it back a little bit. So looking into his nose, bilaterally, I don't see any redness or swelling to either nostril. Medially, his septum is midline. I don't see any deviation to either side. And his turbinates are pink and moist bilaterally as well. Alrighty, so moving on to his lips. His lips are pink and moist. I'm gonna go ahead and inspect the inside of your mouth. Open your mouth for me. Alrighty, so his gums are also pink and moist. His teeth, I don't see any cracks or no dental decay with that. His tongue looks smooth, pink and moist. Open your mouth one more time. So his buccal mucosa bilaterally are pink and moist. I don't see or know any lesions. His hard and soft palate are also pink and moist. Open your mouth, lift up your tongue. So I don't see any nodules, lesions to the bottom of his tongue. It also looks pink and moist, no redness. I'm going to take a look at his posterior pharynx. Open your mouth, stick out your tongue. Alrighty, so his posterior pharynx is also pink and moist, no redness noted or any postnasal drainage. And he doesn't have any tonsils, but if he did, I would be grading those. So moving on to cranial nerve number 10, which is the vagus cranial nerve. I have you say off for me. So I can tell that the soft palate and the uvula, they both rise symmetrically with phonation. With cranial nerve number 12, the hypoglossal cranial nerve, I'm going to have you stick out your tongue and then move it left and right. So it's pretty symmetrical, no deviation with that. So cranial nerve number 12 is intact. Alrighty. So moving on to his neck, inspecting his neck, it's symmetrical, no deformities noted, it's pretty midline. Checking the trachea, palpating trachea, it's midline as well, no deviation. Palpating the carotid arteries, one at a time. Carotid arteries bilaterally or 3+ bounding, and they're equal. I'm gonna go ahead and auscultate the carotid arteries with the bell side of my stethoscope to listen for any bruise. I'm gonna have him take a deep breath and hold it just to avoid any distortion or extra sounds with the lung sounds. Take a deep breath and hold it. All right, breathe a little bit. Take a deep breath and hold it. Alrighty, I don't hear any bruise to bilateral carotid arteries. Now we're gonna go ahead and move on to the thyroid gland. I'm gonna find the 2 landmarks in order to find the thyroid gland. I'm gonna first find the cricoid cartilage, which is right here, and then the suprasternal notch, which is right here. So in between those 2 landmarks, I'm gonna palpate. Go ahead and swallow for me. So it rises symmetrically. I don't feel any nodules or any abnormal borders. The thyroid gland feels normal in size, very symmetrical, nothing abnormal, so it's pretty much intact. Do you feel any tenderness?
No.
So no tenderness there either. We're gonna go ahead and move on to the range of motion of the neck. I'm gonna have you flex, so chin to chest. Extend, look up at the ceiling. Lateral flex, so ear to shoulder, both sides. And then rotation, so look over your shoulder. Okay, good. So the range of motion of his neck is intact. Cranial nerve number 11, which is the spinal accessory cranial nerve. I'm gonna have him shrug his shoulders as I add resistance. Go ahead and shrug your shoulders. All right, good. So cranial nerve 11 is intact. Alrighty, so moving on to his chest. Well, before we move on to his chest, I'm gonna go ahead and palpate his frontal and maxillary sinuses. So frontal sinus, any tenderness?
No.
Maxillary sinus, any tenderness there?
No.
Okay, good. So those are pretty much intact. No tenderness there, swallowing. With his temporal mandibular joint, I'm gonna go ahead and palpate his TMJ. Go ahead and clench your jaw, okay? And then open and close your mouth. So I don't feel any subluxation, any crepitus with his TMJ or any clicking sounds. Does it hurt? Did it hurt whenever
No.
you're okay? So his TMJ is pretty much intact. Moving on to his chest. As he's taking respiration, as he's breathing, I can tell with his respirations that his chest rises and falls evenly, symmetrically. There's no deviation or any abnormalities with that. And then I'm gonna go ahead and listen to his heart sounds with both the bell and the diaphragm. Sides of my stethoscope, starting with the bell side. So on this right side, second intercostal space. On the right side of his chest is the aortic. Second intercostal space on the left sternal border is the pulmonic. Third intercostal space on the left sternal border is the Erb's point. Fourth intercostal space on the left sternal border is a tricuspid. And then fifth intercostal space, mid-clavicular line on the left sternal border is a mitral valve. So, heart sounds are normal. I don't hear any gallops or murmurs. Now with the other side of my stethoscope, I'm gonna go ahead and listen to the same location. So second intercostal space, right sternal border is the aortic. Second intercostal space on the left sternal border is the pulmonic. Third intercostal space on the left sternal border is Erb's point. Fourth intercostal space, left sternal border, is a tricuspid. And then fifth intercostal space, midclavicular line on the left sternal border, is the mitral valve. Again, I don't hear any abnormal heart sounds, no more murmurs or gallops or anything like that. Alrighty, and then now I'm going to go ahead and listen to your to your lung sounds. So I'm going to just have you take a couple of deep breaths for me. Listening to the lung sounds here. Alrighty, so I don't hear any abnormal lung sounds or adventitious lung sounds. Lung sounds are clear, equal bilaterally. I'm going to have you stand up and I'm going to listen to your lung sounds posteriorly. Let's go ahead and turn around. Turn around towards the camera like this. Right. I'm going to start above the scapula here. And I'm also going to go ahead and listen to the right middle lobe over here too. So go ahead and take a deep breath in and out. So no abnormal lung sounds. They sound clear, equal bilaterally. You can go ahead and have a seat. So moving on to inspect the skin of his hands and his arms bilaterally. I don't know any discoloration or any rash, abnormal lesions to his hands and arms. And go ahead and see your hands. So looking at his joints, I don't see any deformities, any redness or swelling to his hands and joints. I'm gonna check his cap refill. So cap refill is less than 3 seconds on this side, pressing the nail bed and then releasing. Cap refill is less than 3 seconds on both hands bilaterally. I'm gonna go ahead and palpate your radial pulse. So radial pulse is 2+, equal bilaterally. And then I'm also gonna test your grip strength. So squeeze my hands. Okay, good. So his strength is 5 out of 5, equal bilaterally. So now we're gonna do some range of motion of his elbow. So we're gonna go ahead and flex your elbow, extend your elbow. So the range of motion of his elbow is intact. Now we're gonna do the range of motion of the shoulder. So we're gonna flex the shoulder, extend the shoulder. We're gonna do an internal rotation, external rotation, and then we're also gonna be doing abduction and then adduction. So the range of motion of his shoulder is intact. We're also going to be testing his cerebellar. So with that, we're going to be doing 2 rapid movements. So I'm going to have you touch each finger and do it as fast as you can. Okay, good. And then I'm going to have you flip your hands and then do it as fast as you can, pretty quick. Good, so the cerebellum is intact. Okay, so moving on, we're going to be testing his bicep and tricep strength. So put your hands in front of you like this. So push against me and pull. Good. So that's 5 out of 5 strength, equal bilaterally. Now testing his reflexes. I'm going to test, let's see here. I'm going to test his reflex. So just let your arm fall. I'm going to place my hand, turn it out this way. I'm going to place my thumb to the medial aspect of his antecubital fossa. And then I'm going to strike my thumb. Okay, good. So that reflex was 2 plus brisk. Now checking his patellar reflex. I'm going to strike his patellar right beneath the patella right here. I have him kind of dangling his foot. Just relax your foot. And then striking below the patella. Good, so that's a 2 plus brisk response to that reflex. And then now with the Achilles reflex, I'm going to have him also relax the foot. I'm going to dorsiflex it a little bit. And then I'm going to strike the Achilles back here. That's a good 2 plus brisk response to the Achilles reflex as well. So good reflexes there. Let's see here. So I guess we can go ahead and move on to your abdomen. I think I pretty much got everything here. Alrighty. Well, let's go ahead. I'm gonna have you lay on this bed. I'm gonna adjust the camera. Go ahead and lay down the other way for me. I'll set this stuff over here. Alrighty. So I'm gonna go ahead and start by doing his abdomen. So I'm gonna expose your abdomen a bit. Alrighty. So I'm inspecting his abdomen. I'm looking for contour and symmetry here. His abdomen is flat and symmetrical. I'm gonna then auscultate his bowel sounds in all 4 quadrants. So bowel sounds are active and present in all 4 quadrants. Next, I'm going to auscultate his aorta, his renal arteries, and his iliac arteries. His aorta would be found right below the xiphoid process. His renal arteries are going to be above the umbilicus, and then the iliac arteries are going to be below the umbilicus. And I'm going to listen with the bell side of my stethoscope to listen for any bruits. So, auscultating the aorta. And then now auscultating the left renal artery above the umbilicus on this left lateral side. And then on this right lateral side above the umbilicus, the right renal artery. Below the umbilicus on this right lateral side for the iliac artery. And then the left iliac artery on this lateral side below the umbilicus. Alrighty, so I didn't hear any bruits or any abnormal sounds with that. Moving on to percussing the abdomen. We'll go ahead and percuss the abdomen for any tympani, dullness present here. Alrighty, so no abnormal sounds there either. Moving on, I'm going to be palpating his abdomen for any tenderness or any abnormal mass. Let me know if you have any tenderness. No?
No.
Okay, good. I didn't feel any abnormal masses within his abdomen there. So now with the liver, I'm going to go ahead and place one of my hands under his back here. And then with this other one, I'm going to go on the costovertebral edge here. I'm going to have you take a deep breath, and I'm going to push up and in. I don't feel his liver or the edge of his liver, which is a normal finding. That's what we want to find. And then on this other side for the spleen, place my hand back here and then go on this costovertebral edge. Take a deep breath. Push up and in. Sorry. So I don't feel the edge of the spleen there either, which is normal. Alrighty, so I think we're pretty much done with your abdomen. Moving on with his lower extremities. Let me make sure we can see your lower extremities. Oops. Okay. So, taking note of his skin, I don't see any edema, redness, swelling, discoloration to his lower extremities. I'm going to palpate his dorsalis pedis pulses. So his dorsalis pedis pulses are 2+ bounding equal bilaterally. Good. So I'm going to do the range of motion of his knee here. I'm going to have you flex your knee and then extend your knee. So pretty good intact range of motion to his knee. Now with your hip, I'm going to have you flex your hip, and then we're going to do internal rotation, external rotation, and then we're going to do abduction and then adduction. So the range of motion of his hip is also good and intact. We're going to test the strength of your knees. So go ahead and put your knees up for me. Put them up on it. Okay, and then raise them up. Push against my hands. Good. Pull. Good. So there is a 5 out of 5 strength equal bilaterally to his knees. Go ahead and extend your feet out. Alrighty. So we're going to do range of motion of his ankles as well. His ankle as well. So I'm going to have you dorsiflex your foot, plantar flex your foot, and then rotate your ankle there. Good range of motion to his ankle. Next, we're going to test the strength of his ankles. So kind of pull. Good. And then push. Good. 5 out of 5 strength equal bilaterally to his ankles there. Alrighty. Let's see. Alright, I think we're pretty much done with that. We're going to go ahead and have you stand back up. I'm going to inspect and palpate your spine. We can go ahead and go back to this other spot. Alrighty. So go ahead and stand up and turn around for me. So I'm inspecting. Scoot up a little bit. I'm not sure if I can see in the camera. So I'm inspecting and palpating his spine. Well, we're looking for alignment and curvature. Do you have any tenderness?
No.
Okay, no tenderness. I don't know any curvatures, and the alignment of his spine is pretty midline. Now let's check your range of motion of the spine. So go ahead and turn back around. So I'm going to have you flex for me, touch your toes. And then I'm going to have you extend. So raise up, kind of extend backwards, and then lateral flex, side to side, and then rotate. So the range of motion of his spine is intact. Next, I'm going to do the Romberg's test. With this, I'm going to have you kind of put your feet together and then stand just kind of with your hands kind of like that. Close your eyes. And then I'm going to be standing right here next to him to make sure that he does not fall. But we have to watch for any swaying. Checking for balance here. If we don't know any swaying within 20 seconds, he passes the test, so that would be a negative Romberg's test. Okay, good. Next, I'm gonna inspect your gait. So go ahead and walk kind of back and forth for me. I'm inspecting his gait. He's got a good gait. Good gait. Alrighty. It's pretty much intact. No unbalances there. Alrighty. Let me think real quick. I think that's pretty much it. Alrighty. Well, I think this completes our physical examination. Thank you, Edgar, for participating.